Hello, Dr. Kevin Connors here, and we're going to talk about bone cancers, mainly primary bone cancers in this video, in this section. And a lot of the primary bone cancers are adolescent or childhood cancers, and it's very scary for parents. It's very scary no matter what your diagnosis when you hear the word cancer. We understand that. There's decisions to be made. If it's a child, you really don't have a decision. You're going to have to go standards of care. We understand that. But adding some alternative care to the process can give you a better outcome most of the time. So think about how the cancer got there in the first place. There's very few cancers, bone cancer is one of them, that really carries a genetic base. So we have to look at what can we do to change the milieu, change the environment, change the terrain. What can we add nutritionally? What can we look at dietarily? That's the alternative side. If you have to go or you're choosing to go with chemotherapy, radiation, surgery, or something that like, you want to do everything you possibly can to support the body through that as well. Things that you add from an anti-inflammatory perspective, from a specific nutrient that can help kill cancer cells, can only help the conventional therapies that you're choosing to do as well. But when you make that choice to add alternative care, it becomes a daunting task because you're faced with, well, what should I do diet wise? What should I do with supplement wise? My book alone has over 100 different supplements that are proven to be very helpful with different cancers. So when we take on a patient, we test them to get very specific. We don't want people on 100 different supplements. We want people on 4 or 5 specific things that are going to target their cancer. We don't want to put them on radical diets either. That's not healthy. That takes all the joy out of your life. We want to just test for what the fuel source is for that cancer, and then let's eliminate or reduce that. We test for frequencies with the Rife. We test for other therapies as well. What's going to be the best thing to add for you for your cancer? Because ultimately we want your success. We want you to improve your odds. We want you to improve the quality of your life and have a long, many years ahead of you. Now, ultimately, no matter what you do, whether you choose to get care with us or not, that's okay. We're going to be praying for you, and we just ask about that you just put a lot of prayer in your decision as well.